I think that if you look at the body as a whole, sports medicine or sports injuries tend to occur collectively about the shoulder, the knees, and the ankles, probably encompassing 60–70% of what we see, but no portion of the body is immune. The back, the hips, all areas of the body, but the knees and the shoulders in particular. Pain is still the best indicator. Pain during, but in particular pain afterwards. It's not uncommon for us to have an ache or discomfort while we're doing things, but if it continues or lingers beyond the actual sports setting, then it's reason to be concerned. I think your primary care provider is still probably the best source. If you have minor aches and pains, give them a call. Their nursing staff, the staff is usually very helpful. But if you have something that lingers that seems to be very specific, a knee problem, a shoulder problem that just doesn't respond to the usual ice and ibuprofen and rest, then perhaps considering being referred or going directly to your sports specialist. If we look around, probably the most common thing that I'll see about the shoulder is an overuse type phenomenon that we commonly refer to as the rotator cuff tendonitis or an impingement syndrome. If you take someone who does an exercise or something that involves the repetitive use of overhead type activities, it's not uncommon for them to develop a problem with their rotator cuff. So the rotator cuff is probably the most common. Sprains and strains from falls from bikes are also very common. The knee is probably the most simplistic of all the joints. Either it's a strain, a sprain, or damage to the cartilage. We think of the ligaments, we think of the cartilage, we think of the soft tissues around the knee. More of what I will see is the owie. That is a little bit of an overuse, a little softening of the cartilage in back of the kneecap that causes a little pain when you try to get up and down the stairs, that makes you want to move your knee while you're sitting in the theater. Those sorts of things are very common. Warning signs about the knee would include locking or popping or just having the knee get stuck in one spot. And that will probably cover 90% of the things that we see with the ankle. The ankle has more of a tendency to be an acute event that a person can say this occurred on X date specifically. In general, conditioning has a lot to do with injury prevention. Not always. We see our professional athletes that are injured frequently, but I think one of the most important things that people should consider is getting in shape to do an event rather than trying to do the event to get in shape. So if you're going to go out and become a swimmer, you might think about strengthening your shoulders beforehand. If you're going to do some biking, you might think about strengthening your quads beforehand. So if you start thinking in terms of getting in shape to do your event as opposed to doing the event to get in shape, it helps. It varies a lot. It's very rare that surgery is needed for most events. Most things that we do rarely require surgical intervention. The vast majority of injuries can be treated by, first of all, isolating the injury, and at the same time, continuing to mobilize the patient. I think the philosophy over the years has changed. That is, if I go back to 1960 and you injure your knee, we would have you rest. Now we would have you rest the involved part, but continue to exercise or use the rest of the body. That's exactly right. That's probably the hallmark of sports medicine, that is, protecting the area of injury and at the same time trying to maintain some semblance of conditioning with the rest of the body. If you have something that is interfering with the person's activities of daily living, their function, their ability to do what they do, obviously if someone twists their knee and they can't walk, they need surgery. If they injure their shoulder in such a fashion that they can't write or type, they need surgery. So I think interference with a person's function on a day-to-day basis is probably the best indicator. That's a very tough question. I think board certification is useful, but probably more important than anything else is word of mouth. If you have questions about your physician, call the hospital, call the operating room, and ask the operating room nurses who would you have do your knee or who would you have do your shoulder. And that's probably the best source of a referral that one could get. Thank you. It was my pleasure.